Let me show you what frozen shoulder is. Let's talk about one of the things that will bother you the most with frozen shoulder, your actual joint capsule. That is what is freezing. Your capsule is what I like to think of as saran wrap that has gone around this joint many times. Now, this is the back part of your shoulder, not the front part. And so your joint capsule surrounds the whole head of your humerus. Your humerus is the bone that is your arm, and it comes up and inserts into the glenoid fossa. This type of joint is a ball and socket joint. But the glenoid is relatively shallow, and so it needs a cartilaginous rim called your labrum. It's kind of like the best friend of the meniscus in your knee, very similar materials. Then that whole joint is wrapped in the synovial capsule, and that is where it envelops that whole shoulder complex. The glenohumeral ligaments make up that capsule, which ligaments are just thickenings of the capsule. And on the inside, it makes a Z-shaped pattern. It makes external rotation exceptionally limited when your shoulder is frozen and that capsule is tight. It's like a check rein ligament. Stop. When you have frozen shoulder, it is a dead giveaway that your capsule is frozen because stop, that hard stop. It was made to be that way as a kind of like a backup protective mechanism so nothing pushes our arm way too far out. Now, the other thing that is very problematic is the coracohumeral ligament, which is not visualized here, but it goes from the coracoid, which is this little thumb-like projection where your pec and the short head attach the short head of your bicep, and they come across from this little thumb-like appendage to the humerus. So this coracohumeral ligament, and your bicep runs underneath. This also becomes exceptionally problematic. So we have this joint capsule being issues, the coracohumeral ligament being issues, and then the long head of the bicep is coming down. And your coracohumeral ligament anchors itself to the superior aspect of the capsule. So of course it's going to be mad when the capsule is mad. So if you haven't talked to your doctor or physical therapist yet, please do. And I have a playlist on frozen shoulder and a TikTok series on frozen shoulder you should check out.